Greetings, class. I wanted to take just a few minutes of your time to talk to you about assignment number 3. The purpose of this assignment is to give you the opportunity to connect with a population, a community, or individuals with a specific health issue through messaging. We know that health messaging is a critical component to building capacity for resiliency through awareness and providing evidence-based information. So for this project, you will start out by identifying a population as well as a health program for which, or rather a health issue for which you would like to direct your health messaging. And now that population and that health issue could be any one of a number of groups. Perhaps you want to focus on adolescents with diabetes, or perhaps you want your health messaging to focus on young adolescents who are at risk for STDs. So we need to identify a population as well as a health issue to then direct or to think about the health messaging, which will be specific to that population and that health issue. Note that your health messaging should be focused on the 3 levels of prevention for the selected program centered on the health issue or population. Is a good example within the instructions and the example that is within the instructions states if the program encompasses, the program could perhaps encompass a mobile clinic addressing sexually transmitted infections for young adults in rural areas. So we have our health issue, we have our population, and messaging, of course, I mentioned, should include both primary, secondary, and tertiary. So primary may include safe sex practices based on the evidence. Secondary may include screening services for STIs, ways to access services, and tertiary may include effective ways to manage STIs. So again, important to identify your population, important to identify your health issue, and begin thinking about the health messaging and where you want to move with that direction. For this assignment, you will complete this table. Look at this form. One of the first things you want to do is you want to identify the organization or community group name, the topic or the issue of focus, and then the population. So who will be impacted by your project? And again, this may include diabetic youths, this may include rural patients, but who is impacted or will be impacted by your project? You want to provide a program title and be creative here. Next, you will move into organization capacity. So I want you to think realistically here. What are the strengths of the organization? Who are the agencies that can partner with the organization to carry out this messaging? I want you to provide information on the description of the issue, including the significance. And so provide a synopsis of the need for health messaging for this particular population. When we move to project proposal, this section would uh, include the most points, worth 15 points. It will be important here for you to look at evidence-based resources to support the issue and the programming. So what do you hope to achieve? Whether that be to decrease STDs, to increase vaccination. What are the evidence-based resources that support the methods by which you plan to increase vaccination rates, etc. Uh, Remember that health messaging is a campaign to reach a larger audience. Uh, Evidence-based health messaging, it's important to look at the evidence-based practice behind health messaging for your particular population and your particular health issue. So, will the message be spread through a pamphlet, Will it be spread through social media? And the example that was given within the assignments was a mobile clinic. But you will also include a goal. And so remember, the goal is larger than the objectives. The objectives, and you'll need 3 SMART objectives. Those will help you to achieve the large goal. So 3 SMART objectives, 1 goal. It will be important for you to discuss how you will reach a diverse population. Remember that your health messaging plan should be realistic. Should be realistic. When we move further down, with any type of program, I want you to begin to think about evaluation methods. How will you measure the outcome of your project? Do you want to look at vaccination rates? Do you want to look at the number of STDs in the county? And how will that data be collected? Will it be collected via survey? And then what support services will be necessary for data collection? It's important that adequate time is given following the health messaging to see an improvement in outcomes. So consider your timeline and remember that this is your dream or vision. So what do you want to see changed or improved within your community? Who is that population? What is the issue? And how can that message be spread? And how will you measure the success of that project? Now, I want you to consider for this health messaging project that you have applied for a grant, and the grant is going to award you $40,000. So you will be asked to set out a budget for your health messaging, and we can look at that more closely on the next page. There are some budget line items here, and these can be edited. And remember, you have $40,000. You applied for this fictitious grant. You were awarded $40,000. So how are you going to spend that $40,000 through your health messaging? What amount may be spent on salaries, consultants, equipment? Because if you plan on creating a social if you plan on creating a brochure or a pamphlet or something to that effect, we know that there are costs associated with printing, paper, etc. And then maybe a graphic designer may need to come into play. And so with your health messaging, it'll be important that you consider those different line items. Of course, with any project, we also want to think about sustainability and what partners can help you sustain the project after the grant funding has disappeared. There are some questions for which I want you to reflect on. Remember that for each of these questions that you can answer those, and I do want you to answer those typed within the box. So we are not writing a paper per se. However, there will be times that you want to integrate resources, citations, I imagine, within some of these text boxes. So you can add a reference page at the end of this document. And so again, we'll move on. Here is what you will complete for the budget, that $40,000 that you have been awarded, and exactly how will that be spent? Because with any type of grant, it will be important. They want to know how you plan to spend the money. Okay? Now, if we move back to the guidelines and the rubric for this assignment, you will see that the rubric aligns very closely with the topic areas within this form. So that if you answer these clearly, completely, you should do well on this assignment. Remember, the purpose is to examine 3 levels of care and develop a program to improve population outcomes through a health messaging project. You will develop a fictitious grant proposal and budget around that project. I want you to type directly into the form. Again, there is a rubric that accompanies this form and that aligns with the form very well. If you do cite sources, which I imagine that you will, particularly with project proposal, then you will want to include a reference page. If you have any questions or concerns, please do not hesitate to reach out to me. Thank you.